As the opioid crisis continues, finding new ways to assist those suffering from substance use disorder is desperately needed.
So many of us have heard about how opioids are really ravaging our country, and Oregon and Clackamas County are no different. We know that the opioid crisis hits everyone equally, anyone of various ages, various races, socioeconomic status. It really can affect anyone, and we know that it's reaching deep into our community right now.
That's why Clackamas County Public Health partnered with Clackamas AMR and Clackamas Fire District No. 1 to build a more comprehensive response model in our county called Project Hope. The program uses community paramedics along with a peer recovery mentor to provide crucial follow-up to overdose victims to increase their chances of having a successful recovery.
Project Hope was born out of a need to focus resources around opioid addiction and try to bring those resources to people that need it.
We have programs and resources that we connect people to, and we identify barriers that they may come across when they're battling this addiction, and we basically just help clear the road and put those supports in place to have a real wraparound type support system for the patient going through the addiction.
Whether that is clean and sober living or some other housing, detox, however that looks, it's totally up to them as to how their path goes. We are there for support.
And even though we're community paramedics, we go out into their environment and basically try to get them to interact with us. And I think our biggest challenge is building that trust, which is where we bring in the peer mentors. The peer mentors give us the credibility because they have the lived experience.
So we're really meeting people right where they're at and not where we think that they should be. And we're letting them set their own goals, and then we're just coming right beside them and helping them reach those goals. And sometimes there are barriers and setbacks. What peer support offers is we show up, no matter what. We're somebody that people can count on, and we're building a relationship between two people.
I'd already overdosed a number of times, 6 to be exact. By the time I decided that I wanted to go ahead and take the help that Project Hope was offering me. They came to my house, they interacted with my family, with my son, with my wife, with friends that were there. They interacted with a lot of the things that I needed to do, as well as programs that I wanted to be part of or programs that they had for me to partake in. If it wasn't for them, I don't think that I would be where I'm at today in my recovery.
Addressing chronic opioid abuse with Project Hope not only helps those in their recovery, but provides a collateral benefit to the entire county.
When those overdose patients are in the definitive care that they truly need, it then frees up our fire engines, our fire trucks, our ambulances, and our police cars to be ready for the next emergency. It frees up hospital beds in the emergency room. It lessens the impact on our insurance companies, and the benefits continue from there. All of those things are what makes Project Hope so amazing. And Clackamas Fire District 1 could not be more honored and proud to be partnering with American Medical Response and Clackamas County Public Health in delivering Project Hope to Clackamas County.
As a patrol officer for the city of Milwaukee, having Project Hope as a resource has really improved my ability to help some of the people that I come in contact daily who are struggling with opioid addiction. I feel like as we move forward in the future, we're going to see less crime, more of our regular individuals and citizens that we're contacting are going to get the help that they need, and that's going to help us to feel better about making some progress in a problem that's plaguing the community.
In the end, Project Hope is about addressing the national opioid epidemic on a local level, saving lives, and giving hope to those in need.
If it wasn't for their persistence, indeed it paid off, we wouldn't be having this conversation. I wouldn't be here today. Sad reality is that some family member would probably be putting flowers on my grave. Anybody in the future that can have the ability to have them be part of their life or part of their recovery, that they take advantage of it.
The fire truck! Fire truck!